frustration. This is the way that we bring it down. Down, down, 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 down. Igniting the fire within you. Exalting the melody of freedom. These are the things that will bring it down. Down, down, 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 down. So gather the faithful. Tell everyone to stand and shout loud. Shout loud. Shout loud. Let's bring it down. Let's bring it way down. Let's bring it down. Let's bring it down, down. Let's bring it down. Let's bring it way down. Let's bring it down. Let's bring it down, down. Down, down, down.
Let me tell you, it's in the air. Joy is in the air. Love is in the air. Can you feel it? What it feel like? Freedom. What it feel like? Don't sleep on it, brother. You might get left, sister. Can you feel it? What it feel like? Freedom. What it feel like? Justice. No need to be counted, cause I am down. Down, down, down. Down, down, down. Down for the end of racism, for the end of bigotry, cause I am down. For the end of misogyny, that's right. For all the isms out there, just down, down, down. Let's bring it down. Rise up, people. No more foolishness, and let's bring it way down.
Riding the river of change into the cries of contrition. This is the way that we bring it down. Down, down, 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 down. We are the children of Eden, dancing and celebrating freedom. We are the ones that must bring it down. Down, down, 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 down. So gather the faithful. Tell everyone to stand and shout loud. Shout loud. Shout loud. Let's bring it down. Let's bring it way down. Let's bring it down. Let's bring it down, down. Let's bring it down. Let's bring it way down. Let's bring it down. We've got to bring it down. Down. Stand up and shout. Stand up and shout. Rise together.
Accountability starts now. The Eric Dawson Radio Show.
Yeah. Rise up. Stand up, shouting loud.
If you are not prepared to come to that table and to represent that voice, don't come. Because we don't need any more brown faces that don't want to be a brown voice. We don't need black faces that don't want to be a black voice. We don't need Muslims that don't want to be a Muslim voice. We don't need queers that don't want to be a queer voice. And if you're worried about being marginalized and stereotyped, please don't even show up.
can give you independence. Nobody can give you freedom. Nobody can give you equality or justice or anything. If you're a man, you take it. If you can't take it, you don't deserve it. Nobody can give it to you. I'm for anybody who's for freedom. I'm for anybody who's for justice. I'm for anybody who's for equality. I'm not for anybody who tells me to sit around and wait for mine.
Welcome, guys, to another episode of the Eric Dawson Radio Show. I'm here with Vincent Squire down in South Jersey in Camden County. He is a candidate running for U.S. Senate on Democrat ticket. He's running against Cory Booker, who is the current senator. And I want to say before you all know Diane Elmurray Clements. I mean, how can you not know that face, right? So, but I want to congratulate Vincent Squire. You are on the ballot. Is that correct, Vincent?
That is correct.
There you go. So, congratulations.
Thank you.
You know, so how many signatures were required to get on the ballot?
Well, required is 800, but you want to get pushed for 1,000.
And how many signatures did you turn in?
Oh, 1,600.
All right, and now usually when you're going through this process, part of the way that the party kind of weeds you out, right, is by disqualifying signatures that you have. Have you gone through that process yet?
Well, no, I don't. We haven't actually gotten to the challenge phase yet, and I'm suspecting that we won't due to the pandemic that's affecting America.
Mm-hmm.
So it gives us an opportunity to level some of the playing field.
So what's going to happen? I mean, a lot of these states are suspending their primaries. What's going on in New Jersey?
There's no word on New Jersey right now. We believe that primarily because all of the commands in New Jersey comes from the governor. The governor right now is looking at containing the spread of the virus in New Jersey. Right now, in terms of the virus, I've talked to a few friends of mine that work at hospitals. We're not even at the apex of this. In fact, we're just starting to get to some huge spikes, and the hospitals are overfilled. They're short on equipment. They're in need of ventilators. They're in need of space. And, I mean, right now, in terms of the great minds and government of New Jersey, they've got their hands full. So worrying about a trivial election to them is not top of their priority list.
Yeah.
You know what? I think that it's always on the top of their priority list, right? You just don't know it's on top of their priority list. But it's always on top of their list of priorities. But yeah, I think that the number one thing has to be containing this virus, right? And if we don't have that at the top of our list, which a lot of people in our community don't, and we'll talk about that in a little while. We're in really big trouble. I want to first tell people, if you have not, if you didn't listen to yesterday's show, I would ask you to go back and listen to it and share it. I listened to it last night, and it was very, very powerful show. We had Dr. Wright on, and we had a friend of mine who's what would you call him? A counselor or a life coach of sorts, who was on, and the conversation yesterday was around how we're coping with this. I got to tell you, I spent time, and I don't know if you guys are doing it. And Diane, I got to tell you firstly, the spiritual passages that you put up on online, I think kind of help balance some stuff, right? Because there's a lot of jabbing, there's a lot of hard cutting. A lot of folks, just kind of have their raw emotions, out there on display, trying to figure out, as Dr. Wright said, as they free fall, as they lose control, during this time, they're trying to ground themselves in something. And so, to wake up this morning and to see what you posted, though I'm not a church going person, I understand it. And it gives some balance to the chaos that exists right now. So I want to thank you for that. And, I'm sure, it provides some comfort for some people. But, there's a lot of pain right now, a lot of pain. I got off the show yesterday, and during the show, I was talking about the calls that I got. By the way, guys, my sister, Kim, is doing much better. Her fever broke. She still got a lot of aches and pains. And I told her, because I'm just like slowly getting in a different kind of space. I said, maybe we need to find a new profession for you. And she said, this is what I do, Eric. And I said, but I just don't know that, people are really grateful.
What's her profession?
She's a nurse.
She's a nurse.
Oh.
Right?
Yeah.
So I said, I just don't know.
Grateful for nurses. My mom was a nurse. I love nurses.
No, I'm not talking about you, Diane. I'm talking about, people.
Yeah,
when we talk about selfishness, right? Self-centeredness, when we talk about those kinds of things, and then I look at, what my family went through over 48-hour period, as we were deeply concerned about her, as we looked at her children and wondered, what they were going through and tried to comfort them from afar, right? Because we can't be there. And I'm looking at the folks who are still playing basketball in the street, Diane. I'm looking at folks who are complaining that they can't go and have parties. I'm looking at the mass conspiracy theories that are abounding on social media, and I'm saying none of these people give a damn about her. But if they contracted COVID-19 and wound up in her hospital, they would fully expect that she would risk her safety, her life, to care for them.
Right.
You understand what I'm saying? So I'm in a real different place right now, and I am, I'm taking stock of the people that I'm around, that I allow myself to be around, and recognizing that a lot of them, and it's disappointing, it's hurtful, but a lot of them don't have my best interest at heart. They don't have your best interest at heart, or yours, Vincent. They don't have my family's best interest at heart. And when this thing is all said and done, there'll be a lot of social distancing that I do even without COVID-19.
The thing is, and it's funny that you say that. I was talking to a friend this morning. He's down in Atlanta, Georgia, and we were just talking about going through his Facebook feed and blocking people. And I was telling him I had snoozed, because you have this option, you can snooze people for 30 days. There's just some of the nonsense that they're posting, the negativity. Nothing is positive. Everything is just doom and gloom. And I understand people are watching the news way too much and soaking in too much information, but it's spilling over into everything else that they're saying and doing. And you're right. There are some people that we're going to have to snooze and block and social distance ourselves from. And like you and I talked earlier, this is the time when you actually see who people are truly in a time of crisis, whether they're going to be protectors and providers, or if they're going to run and hide, or if they're going to be there to lead you. So you'll see all of those things happening right now in people, and you're going to look at people really differently after this.
Yeah.
Oh, well, one of the things I've been saying since this incident has started is that what we run into is adversity. And adversity truly introduces a person to their true self. And like you said, some people are looking for that spirituality, that balance, and that God in which they serve and believe in to help them get through and bring comfort through times of pain. Because we're at a point now where just about everybody you talk to knows somebody or has been affected, physically by this, as we are all, being affected, with some emotional damage, some financial crisis, and that sense of, I guess, lack of control of the situation. And what we're finding out, and Eric, you and I talked yesterday about this, is that we're finding out that some people are, the people who are standing up, or the people who, in the event of a fire, would run in it to see who they could save, are now being upset with the people who are just grabbing all of their belongings and running out. And, we're running into, we're getting upset by seeing people be completely selfish outside playing basketball. My wife was appalled when she went to Walmart and seen this woman with her newborn baby in a cart. People fighting in line. I mean, people getting upset. If anybody would sneeze, people would, really want to beat the crap out of them, or cough, or any non-voluntary function. People, pushing, fighting for the last roll of toilet tissue. It's incredible how you get to get disgusted with how we have become so inhumane.
Well, you know what I find to be fascinating? So, I got a call yesterday from my mother, who was told me that a friend of hers was at a Costco, and she had a mask on. She was protecting herself, and there was a woman behind her who she thought was too close, right? She's trying to practice safe, or, distancing.
Yeah.
And so she asked the woman if she could back up. And I was told that it almost literally, so my mom's friend is like in her late 60s, early 70s, that it almost broke out into fisticuffs in Costco because this woman wouldn't back up. And the woman said to her, "Well, you have a mask." And this woman had no mask on. And this woman said, you're the one with a mask on. Why do I have to back up? And, but I'm looking at that and I'm saying, see, so it's not just that folks want to go play basketball. It's not that they want to party. It's not that they want to, do these things that we think are benign, right? They literally want to endanger you. They believe, and I'm telling you, I don't think that mentality is far from the mentality of folks who are involved in other destructive behaviors in our society that bring us down. I mean, this one just can kill us, but I think it's all bundled up into the same kind of person, right? And we have to begin to take stock and recognize it, that it's it's just not somebody wanting their liberty to do something, right? It's somebody wanting to kill you, somebody wanting to harm you. Or at least that's how I'm looking at it now. I don't find it funny. I don't look at it lightheartedly. I literally look at it and say, you have information that says to you that you may be carrying on your person, right, a virus that is highly contagious and that we know is killing people by the thousands a day. And your belief is that you should be able to walk amongst everybody and possibly infect them because you have a singular belief about some conspiracy theory.
Well,
or just a disregard for life.
Well, the been walking amongst us for many years, and we just haven't been in a situation to recognize who they actually are. They are selfish, and we need to call people for who they are. They are selfish in how they act. They are selfish in the things that they do. We see it all the time. We've seen it on the job. We've seen it in our relationships. People are all individuals, and they make choices. And sometimes they choose to be a team player, and more times they choose to be individual. And that's a big problem. That's the problem with the world in which we live in the United States. Now, if you go to other countries and you watch how other countries are being able to lessen the burden of this virus in their countries, is because they know how to work as a team. They know how to work as a group. They're not constantly fighting back government and feeling though it's us against them. They understand the difference between safety and loving thy neighbor. We don't have that concept here.
So where do you separate, Vincent? Because the countries that Diane is talking about, they don't necessarily promote free thinking, right? They don't promote democracy. They promote monolithic thinking. They're totalitarian in some instances, communist in others. And we pride ourselves on our democracy. We hold and cling to the Constitution, and we promote individuality, right? In fact, like Dr. Wright said yesterday, we see evidence of that in our lives every day. We look in our homes. Many of the countries that we're talking about that are doing it right, they don't have these big homes that we have here with multiple rooms where each kid has their own room and each child has their own television and each child has their own PlayStation or Game Boy or whatever it is, and everybody has their own telephone. And I mentioned to Vincent that when I was in other areas that I lived in when my kids were growing up, I lived in a cul-de-sac right at the end, and there were 4 houses there. And Diane, each of us had our own basketball hoop in front of our house. Do you understand what I'm saying? So that level of individualism we promoted and and support and encourage, right? And so that
I think that also comes with age and the time too, because think about it, Vincent, as well. When we were younger, and I know y'all way older than me.
Wait.
When we were younger,
here's my shock face.
if Angie had the basketball and Tawana had the jump rope and so-and-so had the jacks, we were all bringing our stuff together and we were playing together. Yeah. We didn't worry about everybody having individual footballs. We only needed one football and everybody played with that football on the street. If we played kickball, we had one kickball and 2 teams and we all played together. Right. That's how we grew up as a community. We don't have that anymore, and we have to. I think this time that we are being isolated is a time that we have to come back, and it has to continue, because we did this mini experiment when 9/11 happened. Everybody was, oh, I love America. Oh, I'm so American. Oh, this, and we're always looking out for our fellow neighbor. But we really weren't doing it. We were pretending. We really need to get back to the place.
I don't think that we were looking out for our fellow neighbor. You know what I think happened? I think that we were so fearful, right? That we were free falling. So I'm going to go back to what Dr. Wright was saying. We were so out of control in 9/11 that we were, imagine if you were falling down a shaft, right? Like an elevator shaft. You were just free falling. You'd be reaching to grab anything you could to stop your fall, right? Doesn't mean you care about that thing. It means you're caring about you. And you will grab onto anything, you will cling onto anything, you will step on anything to save your life. And I believe that that's what happened during 9/11. I don't think that it was a level of compassion for other folks. I think that they saw that other folks could provide them a level of security, and they were willing to do that. And it was masked in this sense of togetherness. But that's not really well. I mean, I think that there's an ugliness that exists here in this country that we don't really want to spend time talking about, but we have to talk about it if we're going to get to a better place. Because I'm going to tell you, These pandemics are not going to stop, and when they worsen, it's going to require, if we're going to get through it, it's going to require us to get through it together, and we're only going to be as strong as our weakest link. And that's why I'm saying to you, and I said it the other day, my father said, those who you won't let die won't let you live. And so if we identify, so for me in my life, I identify these weak links. I recognize that if they're not inspired to be better, if they're content and wallowing in their ignorance, then I have to let them go. But if you're ignorant, but you're inspired to be better, right? You are intellectually curious, then we can continue to dialogue. But outside of that, I gotta let you go. And I think that that's gonna have to be, what was that movie? We talked about it yesterday, Vincent, where they took all of the people and they put them on one island and they said, go for it. See, we got to take all the people who want to play basketball, all the people who want to wild out and have parties and hang out on the street. We need to cordon off an area and say, you go there, all of you. And then when you infect yourselves, you stay there. I'm sorry, Diane.
Yeah, Escape from New York.
Vincent, what was the book? It was a book I read in high school, and I can't think of the name of it, but one of the characters they called Piggy. And it was a bunch of teenagers, and they got stuck on an island, and they had to...
Lord of the Fleas.
Yes.
Of the fleas or flies?
Lord of the Flies. Lord of the Flies.
Lord of the Flies, yes.
So, was that a Freudian slip, Vincent?
Historically, what we've experienced
Lord of the Flies. Lord of the Flies. That was
Lord of the Flies, yes.
Yeah.
Pre 9/11. American, our society was coming out of that 80s Republican mantra of pull yourself up by the bootstraps, look out for number one, make it as much as you can, and step on everybody on your way to the top. It has been a me, all about me society. What 9/11 did in the post-act of 9/11, what it did was it made America once again monolithic. Now, let's break something up. Real sidebar.
Are you serious? You believe that?
Well, I can't hear you.
I said, you really believe that it made America monolithic?
Yes. For a short period of time, we were not focused on individuality because we realized that it was an attack on America or all of us. Now, in terms of monolithic, the difference that people say is that there's no such thing as black unity. Well, here's the thing. There's no true thing of unity, period, for a specific or a long period of time. We come together for certain events.
Well,
we become monolithic when we're all celebrating one particular holiday that we all can agree upon. We become monolithic when every 4 years the United States is waving that flag of victory in the Olympics. We become monolithic.
Well, wait a minute. But you know what? That's all superficial.
No, let me finish.
But that's all. But I'm understanding
you.
your.
Eric, please.
But I need you to get to the point.
Before you change it, let me bring it home.
Bring it home. Come on.
What we have to do is realize one thing. The United States was made on the Constitution that one saying, e pluribus unum. Out of the many, we are to become one. And with this, and in terms of other countries where there's a totalitarian dictatorship or government, the difference between what they're experiencing right now and getting through it and us is the simple fact that they trust in and believe in their leadership. It starts from the top down.
Right.
What we have now are individual governors making leaderships because our president is not saying, no, this is the path in which we should follow. So now it's breaking up into three different categories. There are people who believe because it's hitting home. There are people who don't believe because they are so distant from it. In our country, the African American, where the average income of the
but I want to unpack this because now you're moving on to something else. That's what I'm trying to.
Because it covers the point that Diane talked about and you talked about.
Right.
In our country, in the 70s, when the average income from African Americans was $13,000 a year, that's where we became a community. We couldn't afford to, get a room for every child that you had. You couldn't afford to buy everybody individual PlayStations and TVs in their individual room. You had one TV one radio, and the only time the children got to use it is when mom and dad went to work. Everybody played with everybody else's things. We shared. We were a community. When
Vincent, I need you to. Okay, yeah. I want you to bring it home so that I can address it. So here's the issue. When you say that we were monolithic after 9/11, I'm saying it was very superficial. See, because what I want you to do is always when you put that out there, let's look at the data, right? Because the data suggests that we weren't. If we're looking, and I'm telling you, I'm gonna use as the marker 1952, where Dr. King said, we got 40 million poor people here. What are we doing about that? What are we doing? It created a monumental shift in his thinking. He said, what are we doing about that? So now let's go 9/11. We didn't reduce the number of poor people. We didn't reduce the number of homeless people. We didn't close the racial wealth gap. We didn't close the racial income gap. We didn't close the gap between what women and men make. We didn't do any of those things. So when you talk about monolithic, I'm saying it was very superficial. It was emotional.
No, it's not very superficial. It was very marginalized. And after the post 9/11, what did we actually start to have in terms of closing our social, not economic? Let's look at it in terms of closing our social gap. At the post 9/11, we had 2 African Americans win Oscars. We had
Vincent, are you kidding? Vincent, are you kidding me? So
that's just the start. Post 9/11, we've had more African Americans graduate.
You know what that is? That is maximum sophisticated confusion. That is maximum sophisticated confusion. Because what I say to you is, what is the end goal? Was the end goal for us to get 2 people winning Oscars? Is that it?
No, that's not the end goal. What I'm saying is that we have made strides as little as they have been. Also, if you look at post 9/11 was actually the birth and emergence, because after 9/11 we had Katrina, and because of people seeing the suffering, we had a lot of fuel and a lot of exposure of a senator named Barack Obama.
But and I'm gonna read from the feed. Dre says Americans are not disciplined. That's the reason why we're in this situation right now. No matter what the color is, as Americans, we just don't abide by the law. So we're not monolithic because we're all doing
That's what I'm saying. I don't understand what Vincent's talking about. I see absolute chaos out there, and you say that we were There's always been chaos. It's just been masked. See, what I'm saying is this. They just fed us. So when I say that they feed things to comfort the symptom, but not to deal with a cure for the call, right? I'm saying the symptom was there were some people who were saying we don't have enough black people winning Oscars. So yeah, we give you an Oscar, right? But that didn't really do anything. And I'm saying none of these things did anything. True monotheism is when you look. You know what it is? Look at what, and I meant to send you the article, Diane. What Taiwan did during COVID-19. That country who was predicted, they were predicted to be like second to China in terms of devastation, right? They have one of the lowest rates of fatality and actual people who contracted it because they moved in unison.
Leadership.
Call it go.
It was all about the leadership.
Call it go.
When they told Taiwan of their predictions, the government or the leadership in Taiwan did an emergency shutdown.
No, I'm not saying that they didn't do an emergency shutdown, but I'm talking about the people didn't riot.
Nobody's rioting here.
No, they aren't. Whoa, no. We're going to just agree to that. Go ahead, caller.
Go ahead, caller.
I think there's a delay. Good morning, y'all.
Good morning.
I think there's like a time delay from the way I was watching. So you guys are on a different subject, so I'm going to just leave it alone. I'm not going to go backwards with it. So I'm going to just sit back and listen.
I didn't say it. Go ahead.
Go ahead and say what you guys say.
When I was at the point I was at, you guys were talking about blacks, I guess, being monolithic in the approach after 9/11. That was what Vincent had just brought up, and Eric was saying something. And I just wanted to say, the way I saw that was not that blacks were monolithic, but what in actuality, what it was, America or white America was monolithic in their racism again. And they were monolithic. They were monolithic in their racism towards Muslims, right? So America went against Muslims, and it needed to invite Black America into the conversation. So then we end up with Oscars and presidents and other things to say, hey, we need y'all to be part of this fight with us. Because maybe if Black America hadn't been what we were, let's just say, mentally in 1944, when we saw it as we all Americans, and it didn't matter that we didn't have anything, but we all went right after Pearl Harbor and volunteered.
Correct.
Right? We jumped in there. So because when we jumped in there for that fight, it was because we all thought we were Americans. But after Vietnam, our position about the military and war became different, right? Martin Luther King, in fact, helped us to become different in our thinking about being part of, and Muhammad Ali. They helped us to become different in our view of our Americanship. So what this Dutch country, this government with that corporation for white supremacy did was say, well, we got to get blacks on board with us too for this war we're about to have against Muslims, against the Islamic world. So what they did was they said, well, let's start inviting them in again. Let's give us some things to feel more American.
Well, and then if I could add to what you were saying, the biggest piece was this. They said that, the world or the Muslim world or the Middle Easterns consider us to be the white devil. So let us now put, another spin on it or a face of what you call the white devil. Barack Obama was the most celebrated man in the world because of him making that point and making that change. You look at Muhammad Ali and Reverend Dr. King and Malcolm X. That got white America to make two choices, the lamb or the ram. That's what made that change. Now, what we have to do now, and in fact, if I could go on, when we volunteered for World War II, blacks had to actually do the same thing there, prove themselves. And from that generation, we've got two groups that have the greatest record in military history, the Harlem Hellcat Fighters, one of the best mechanized infantry in America's history, and the Tuskegee Airmen, who have never lost a bomber. So we still today have to prove our Americanship, involvement with Americanship, and our participation in building America. That part, my friend, is what I am working to change. I want this America to be where my son does not have to prove how worthy he is. He is not judged by the color of his skin, but by the amount of his character and the ability for him to accomplish the job and do an excellent job and work.
Right. But let's get back to what we were talking about. But let's get back to what we were talking about. We were talking about whether or not.
I love when people tell me it's never going to happen. It's going to happen.
Vincent, I don't want. We can't talk over each other, right?
The article you were talking about with Taiwan is knocking me out, so I can't see it. But I know you were talking about how they got ahead of this. And how their new normal may be wearing masks in public. They're trying to make that one of their mandatory things. What did your article say?
Well, the article said this, that what Taiwan did, firstly, and I encourage you guys to read it, but firstly, Taiwan said that, they challenged some of the information that was coming from the World Health Organization. They challenged some of the other stuff. Based on their adversarial relationship with China, right, and the fact that they didn't have somebody sitting on the board or commission for the World Health Organization. Then what they did was they immediately went to data, right? But what the foundation that they started with was what they built after SARS. So after SARS, they recognized that these pandemics are going to occur. And so they started building a national database in order to track their citizens, right? And so now they use that database. So and in the article that I put that came from NPR on my page, they chronicled this particular young lady who came back. So she left Britain because things were going crazy in Britain, and she said, "You know what? I want to get back to Taiwan." Why? And to your point, Vincent, she said because our government cares about people, and they're people centric, and so I want to get back there because that's where I feel safe. So she got on a plane, went back to Taiwan. She said when she got there, they immediately took her temperature, and then they put her in a secondary holding cell that she didn't say her rights were being violated for, right? She recognized going back to Taiwan, she was now becoming part of a whole that was trying to solve a problem, right? Not her individual problem, but a communal problem. So she was willing to go into that secondary holding place for them to then screen her. And then after they screened her, they put all of that information into that national database. And then they said, we're going to track you. It further said that when she got home, let me just allow me to finish, please. Right? For people who didn't read the article. So then when they said they were going to track her for 14 days based on the information of the incubation period of the virus. And so her government called her. They also used technology and were texting her on her phone, giving her updates in terms of where she was. They were practicing social distancing, and they were using technology to ensure that folks were complying with the social distancing. So they did all of these things, and the reason I'm bringing them up is because right now, as we speak, some of those same things are being talked about here, but you have people pushing back saying our government is encroaching on our civil liberty. Our government is taking away our rights. And so we have to make some choices about some things, because we can look over there and say, if we're looking at models, right? So we're looking at some models to see where the spread is, why the spread is, what's going on, mitigation tactics. But if we look at the best case scenario in terms of how they resolved it, it would be Taiwan right now. And the question you have to ask yourself is, how close to some of their mitigation techniques do we want to be?
Eric, that is generational, though, right? How long has their government been the form of government it has been? In our form of government, the individual right is greater than the collective right. That is how it has been practiced, right? That you don't step on a single man's liberties, right? And if you do that through government, then you were wrong. So the reason people in Taiwan are not revolting from that method that they're going to, hey, everybody's going to get this note, how you feel about it, but this is what, because their individual rights have historically been under government control and supervision, whereas in the United States of America, it's not been that way. So by it not being that way, we sit back and we say, what? You're going to make me stay in the house? What? You're going to make me, even for my own good? We don't want to hear that. That's something that would take for America years to change. And by that, I mean literally a government system without this.
First of all, let's look at one thing. The Taiwan government and their disease control was modeled after the disease control established by the Obama administration, and Trump gutted out. The second thing is that, yes, Americans are existing.
Wait a minute, and I want to stop there too. No, I'm not gonna, because I'm not gonna let you give false information. I'm not, Vincent, I'm not gonna let you, please, Vincent. But right, I'm not gonna let you give false information. I posted an article, and they talked about it, and you got to read the article, right? Whether or not Trump, and this is from NPR as well, PBS, I'm sorry. whether Trump gutted it, because that's what people are saying. And look, I'm not a Trump fan, right? I don't like any of them, okay? Because they're all liars. But I always want to try to get to the truth. There's a PBS article that I put up, and it talks about what occurred in terms of the restructuring of that department. And they were talking about some consolidations that had taken place because of some overlaps. It wasn't about gutting it. And I don't want to drive a particular media's narrative about what occurred there. I want to put out the facts. Now, if I'm wrong about that, and at the end of this show, I'll post the article in this feed, and then we can have a debate about it. But I want to have the actual information and not just talking points from...
Then reference Joe Biden's speech after the coronavirus. He actually gives in detail what truly happened.
Oh, you can't. That's bias. You couldn't use that. You can't use Joe Biden's speech on whether or not Trump destroyed something that they were doing great in his previous administration.
Then reference the World Health situation on the Americans' role in setting up the policy when we had the SARS virus and the Ebola. What he did was, in cutting out what he called overlaps, was the other group that talked to another group about what was going on in the world and how we need to take action or a plan of action to prevent it or prepare us for it. That's what
excuse me. I'm not to really change the subject, but you just said something about what was going on, and I wanted to ask about it before. Can I just say to anybody that's listening, or maybe in the thread, if you guys know what's happening in North right now, can you put it in the thread? There, for a half an hour, there are sirens going off in North Street. For a half an hour, somewhere between Springfield Avenue and Bergen Street, the sirens right now are crazy. I don't know if something major has happened in this town. But if anybody knows, can they put it in the thread if you can't go outside to see? But I mean, when I say the sirens, there are sirens traveling up and down Springfield Avenue and Bergen Street right now. Crazy.
Maybe they were teaming y'all over there and telling y'all to stay in the house.
But it's crazy. Like,
right. So if somebody sees it or knows, can you put it in the thread? Yeah. We'll try to figure out what's going on.
I'm gonna sit back and listen.
Thanks. But yeah, I'm gonna put that article. I was trying to find it. I'm gonna put it in the thread. Listen,
read some of the stuff that's in the feed. Then.
Okay, you know what? I'm gonna try to read some stuff in the feed. We got a new thing that I'm trying to do on the show. I talked to Diane about it, and I think that I talked to Vincent. I'm trying to pull audio highlight clips from 3 different sources to be able to play as like news breaks. So I got a audio clip from Fox. I got one from NPR, and I got one from CNN. So we're gonna take a news break right now, and I'm gonna try to queue up the Fox one for this break segment. So we'll be right back in about 2 minutes. You guys can listen to it. We'll get in the feed, try to see what we can read, and then we'll come back and maybe answer some questions. Thanks for tuning in. Please hit the share button.
Have died alone in a hospital. I'm Dave Anthony, Fox News. There are more than 1,000 deaths in 24 hours across the U.S., up to more than 5,100, and while New York leads the way...
There are some areas, some hot spots in other states that are really exploding.
Including New Orleans, Detroit, and Chicago. 36 states now have stay-at-home coronavirus orders. This will not be easy for anyone. Mississippi Governor Tate Reeves, but in Florida, church services will be allowed. President Trump's wary.
You get too close, and if somebody's sick, you're going to probably catch it, so you have to be very careful.
As doctors and nurses ask for more masks and gear, and governors warn of ventilator and hospital bed shortages looming, the president acknowledged the federal stockpile's nearly depleted.
Our planes are airlifting supplies from every corner of the earth.
Speaking of planes, he says grounding all airlines in the U.S. would be rough, but he is considering restrictions.
You have them going, in some cases, from hotspot to hotspot.
The airline industry is getting billions in aid from that massive economic stimulus bill. The president also wants 2 Holland America cruise ships With 4 dead passengers and others sick with the coronavirus to dock in Florida maybe today. How that'll all be handled still not clear. The U.S. Navy is getting more sailors off an infected aircraft carrier. Fox's Rachel Sutherland has more live.
Dave, nearly 100 sailors have tested positive for COVID-19 on the USS Roosevelt, docked in Guam. The Navy plans to take at least 2,700 sailors off the ship, but Acting Secretary Thomas Modly told Fox News some will have to remain on board to protect the carrier's nuclear reactor and other sensitive hardware.
That ship is not like a cruise ship. It has weapons on board. It has a lot of fuel on board. It has aircraft, expensive aircraft.
The Navy is working to test all 5,000 sailors on the Roosevelt. The plan is to quarantine sailors allowed off the ship in hotel rooms in Guam. Dave?
Rachel, in a half hour, we'll find out how many more Americans were laid off last week. Millions of first-time unemployment claims are predicted like the record set the week before. America's listening to Fox News.
There's only one way to be independent. There's only one way to be free. It's not something that someone gives to you. It's something that you take. Nobody can give you independence. Nobody can give you freedom. Nobody can give you equality or justice or anything. If you're a man, you take it. If you can't take it, you don't deserve it. Nobody can give it to you. I'm for anybody who's for freedom. I'm for anybody who's for justice. I'm for anybody who's for equality. I'm not for anybody who tells me to sit around and wait for mine.
Welcome back, guys. So, we can open up for what's in the feed. Guys, I also put in the feed the article from Reuters that talks about the nuances of what took place in that department. And we can talk about the truth or the lack thereof of the truth in there. But that is the article that I think out of everything that I read gave a balanced assessment of what actually took place.
So in the feed, some person has said lockdowns and lockdowns and curfews are not going to save lives. Eating healthy, adequate health care and treatment will help you live a long life. Vegetarians have the longest lifespan. Well, we know somebody who doesn't eat meat and is vegetarian, and they're definitely sick right now. So, of course you need to take care of yourself.
Right. So let's have the conversation. Okay.
Yeah.
Let's start with a lockdown. And I see the narrative that's out there about locking black people up, or that black people are now carrying a narrative of the slave master of catching black people and locking them up. Again, can we agree? I just want to see if we can agree to the fact that there is something called COVID-19. I don't want to have the conversation anymore about how it got here, whether it was man-made or not. The question is it here? Now, if we can agree to that. Now, if we can't agree to it, I can't have a conversation with you. Because I think that you're on some other planet, right? And I can't even entertain any further discussion with you. Now, can we agree? So for you guys who are still amongst the brain living, right? Can we agree that it is contagious and that people are dying by the thousands? Can we agree to that?
Not even just contagious, but the fact that it spreads so fast and it's spreading from not just contact of people, but contact of surfaces has to be acknowledged as well.
But I want to ask, but I'm asking, Dan, can we agree to it, right? See, because we have to have a building block. We have to have building blocks so that we can say, so I don't want to be on page...
He's building to his point.
Right. I don't want to be on page 15 of this book and then somebody didn't understand what was on page 12, right? So I want to go along, have everybody go along. Can we agree that COVID-19 exists? Can we agree that people are dying? Can we agree that it's contagious? Can we agree to these things? Now, if you don't agree to some of those things, like I said, maybe we put you over here in this classroom for right now. But now for those people who agree to it, the question is, how do you then have people who may have it, who may literally, the virus may be existing on their clothes, on their person, on their shoes, on their whatever, and you believe that those people should be able to be on a basketball court playing basketball. You agree that those people should be able to go in and out of stores coughing and sneezing and touching things, and you believe that all of that should be able to happen. But at the same time, we should somehow be able to limit the death. We should somehow be able to limit the spread. Somehow we should be able to limit all of what's going on. I don't understand that logic. Call it go.
Hey, good morning, guys. I don't know if you heard the story or I read the story about the train conductor who tried to run the train off the track to run into the Navy hospital ship because he was saying that they were moving the hospital in place to to do what? I don't know, some kind of conspiracy theorist. But yeah, we have to talk about that. We're at a point now that conspiracy theorists is not going to stop like this thing. And now they're talking about black people's comorbidities and pre-existing conditions in the South. I mean, in the North, we got the same problem. The hospitals, not enough hospitals. But in the South, they're saying that the numbers are going to be so ridiculous with people spreading this virus, and they have these pre-existing conditions, and they're not going to be able to fight it off like a healthy person. They're starting to make the decision now that if they go down there and get so bad, they're going to have to let a lot of people go. So, I mean, people need to be listening to what they're saying carefully, because this virus is attacking, first of all, it's attacking all of us different. But if you have these other conditions going, it's going to exacerbate it, make it worse, and you're not going to be able to tolerate or come back from it. They already said if they get to you and they got to resuscitate you, don't even bother. Don't even bring them to the hospital. So people, please listen. Just listen for the true information, because all of these other irrelevant conversations will distract you from what you really need to be listening.
Right. Keeping yourself free.
Absolutely. And the article we're talking about was the engineer who intentionally derailed his train. He drove it at a speeding locomotive off the track at the port of Los Angeles because he was suspicious about the presence of the Navy hospital ship. Yeah, there's a lot of crazy going on. I also read an article in Maine. The neighbors came out to a gentleman's house, cut down a tree in front of his yard to block his driveway to prevent him from leaving the house. There's a lot of craziness going on.
Yeah.
Yeah.
There's and I posted this, guys.
That's mental illness. Mental illness. And then you have this, and it ramps up.
So what we have is a lot of fear. And a lot of the fear that we have is based upon the uncertainty of and unknowing. And people are now starting to act upon, or their true self are coming out about their fears of this virus. One thing that we do know about the coronavirus is that it does not stick to any script. As you said about the vegetarian, as they said about it affects the elderly. A woman 102 had it and survived. As they said about the young, a baby just died and a teenager. Mm-hmm. So what we do know is that no one is safe. And we do know that it spreads. It's 10 times contagious than the flu and spreads a heck of a lot faster, as Lori Thomas expressed to us. So what we do know is keeping ourselves safe should be a priority. Not cutting down a neighbor's tree or going out and playing basketball, but isolating yourself, or actually self-isolation does two things. One, it eliminates your chances of catching it because you're not in multiple areas. And two, it reduces the impact that's happening in the hospitals right now.
So listen, here's the thing that, and these are the things that kind of get under my collar. There's a woman, Tina Thomas. I believe her organization is Loving Hands or something like that, right? She does tremendous work out in the community. Tremendous work. Feeding, I met her feeding neighbors without addresses down at the Newark Penn Station a couple of years ago. She's tireless in what it is that she does, right? And now when she's doing that, when she's just giving people stuff, right? People are applauding her and people are sharing it and people are coming up and they're willing to take it from her. But she put something up on Facebook yesterday, and those same people are not showing compassion for her, right? They'd rather be out playing basketball or throwing their coronavirus parties. But here's what she wrote, and I shared it on my page because it was, you know, one of the many things that got me emotional yesterday. She said, "This is just so sad that the entire world is going through this. My baby brother, who's 40, and his girlfriend, the same age, both tested positive for COVID-19. They live in Atlanta. I, unfortunately, have 2 cousins suffering right now, and the guy I'm dating is also COVID-19 positive." This is one person saying this about her, what her life is like right now. "2 of my coworkers just passed away, and almost everyone I know has a family member or friend suffering from this terrible virus." He said, "Meanwhile, we have these knuckleheads standing on the street corners and basketball courts having a good time. It's just disgusting. If there has never been a time to pray, the time is now." Now, what I'm saying to you is this. So there is just like a complete disregard for the pain and suffering.
Because people don't love thy neighbor.
They don't love themselves, Diane. You know what?
They don't love thyself.
They don't love themselves, Diane. That's what it is. They are reckless and they don't love themselves. And that's what I'm saying. So at some point, we have to acknowledge it, right? So for somebody who doesn't love themselves, and they certainly don't give a damn about me, you now have people out there saying, but don't restrain them. Don't restrain their madness, right? Don't have law enforcement corral them and get them out of the way because they present a clear and present danger to us. I'm saying, what is in your mind to defend that kind of reckless and dangerous behavior?
There's nothing in my mind to defend that because I don't approve of that.
I'm not talking about you.
Oh, okay. All right.
I'm not talking about you. I'm talking about all of the other people who are saying in some way that we should allow them to do this. See, we should allow them to be outside. I mean, it's a damn shame that de Blasio and Cuomo had to shut down the playgrounds.
Not shut them down, lock them up.
Lock them up.
Put bars and stuff.
Isn't that crazy?
People from physically going in because people won't.
Yeah. And it gets crazier because, as I said yesterday, it's difficult to legislate against stupidity.
Well, listen, I want to say, and I posted it on my page yesterday. You know, good friend of mine, Melvin Biddle, lost his battle with COVID-19. Went into the hospital, next day, gone. And when I tell you that you die alone, family can't come, you're there. And that's it. You go in and then understand this too. The way that it is right now, given the lack of hospital beds and the lack of ventilators, the only ones who are going in the hospital are the ones who don't have a good chance of survival. Because they send you home. Like if you are diagnosed, right, they will send you home. Look at even County Executive Joseph DiVincenzo was diagnosed with COVID-19, right? They sent him home. Right? Yeah. Sheriff Fontoura, they send him home. And then what they do is they check you, and if you get bad enough, right, you have to be pretty damn bad for them to be able to bring you into the hospital. And now by the time you get into the hospital, now they're looking at the ventilators they have left and available, right? And then on a scale from 1 to 10, they're rating you to see how desperate you are for a ventilator. Can you hold on while we're trying to save this other person's life?
But not even that. They're looking at your age.
Yes.
Should I give a ventilator to a younger person, or should I give it to your grandmother?
Right, they're playing God.
Yeah.
I don't know that they're playing God. I think that what they're doing is they are certainly prioritizing. Because they have to.
They're making choices of life and death.
Well, that's not playing God.
Which is why I'm saying they're playing God. They're making a choice of who's going to live and who's not. And then there's another choice. Who's best suited for life and who's not. Well, and then there's another choice. The person who is making a choice and how they feel about this old person, black person, white, Asian, or whoever. Yeah. Playing God. Yeah. That's what we force people to do.
I take umbrage with whether they're playing God or not. Call or go.
Hey, this is Will Hathaway. Good morning, Vincent. Good morning, Diane.
What's going on, Will?
Eric, hope your sister's doing well this morning.
She's doing much better.
I like to bring 3 points up, okay? I've been hearing this conversation about blaming American people. Okay, first of all, we need to police ourselves right now. Social distancing, and staying away from each other. But Mr. 45 back in January of this year or February, he stated saying, "Well, Trump knew about this. It's a hoax." It's nothing to worry about. We got everything under control. And also, let's talk about the economic impact at this state of New Jersey's feeling with small businesses.
You're right.
Let me get to the point, Eric.
Get to it. Get to it.
Point, and you can finish yours. Okay.
Get to it.
The economic impact in the state of New Jersey that people are feeling is hurting.
Right.
And also, another point you were driving, the lockdown situation. People are playing basketball. We need to police that.
Right.
That's all.
Thanks, Will. So listen, and I want to address those. Diane, did you see what Sydney posted an hour ago on his page?
I did, but before you address that, I'm going to say, look, it's not just us playing basketball. You got Jewish community in Lakewood having weddings. And not just once, not just twice, but 3 or 4 times the cops have been down here to shut them down.
Right.
So
I have a friend who's Jewish, and his big problem that he had was that this is the Jewish holy high holiday. Passover. And they were told, and they were upset because they were told that they had to celebrate in their houses.
Mm-hmm.
So listen.
So it's a matter of, as Diane said, loving your neighbor, and as Eric said, loving yourself.
So
we got to remember once again that we're in this together.
Here's what Sydney Barnes says, and maybe somehow, guys, if we start attaching names and faces to this, maybe people will develop a little more compassion, right? Maybe if we're just putting numbers up, people can be detached from it. But once we start mentioning names and then putting faces there, maybe that'll draw out some more, feeling compassion. So Sydney Barnes, who was a co-host for a while on the show, who's may have gone and fixed your home or done some plumbing work or some electrical work in your home. He's home now sick. But when he confined himself, he called me. And he said, "Hey, bro, listen, I know that you have a severely compromised system. And as I'm getting ready to go through this thing, I want to know how you're feeling." And I said, "Sid, I said, you need to take care of yourself." He said, "Yeah, brother." He said, "But in the back of my mind, I'm thinking about you." See, so that's the compassion we're talking about. But this is what he says. He says, day 1, he said he had body pain and fever. Second day, body pain, hard to sleep and fever. Third day, vomiting, diarrhea, and still pain and fever. Fourth day, body pain, slight fever. Now, I just want to ask this question, right? Because nobody knows exactly how Sydney contracted it, right? We don't know. It could very well be somebody who decided that they didn't have to conform with, social distancing, right? And contracted it and went somewhere and touched something, and Sydney wound up touching it. And so whatever that thing that led to it. So if we all look at ourselves as possible ticking time bombs, right? So when you have the power, like literally right now, you have the power to spread a deadly virus. You have the power to do that. Or you have the power to constrain it and keep it isolated. See, if I stay here where I am right now, whatever I might have doesn't go out and expose anybody else. And I have the power to do that. Now, I also have the power to walk out of my front door, right? Because I live in America and damn it, I got my rights. Here's my Bill of Rights. Here's the Constitution. And I'm not going to wear a damn face mask. I'm going to walk around the Poppy store. I'm going to sneeze in there in my hand and touch the counters and all those things. Right? I do that. Right? And then I'll have some of these people who are on Facebook who will come to my defense and say I shouldn't be arrested. That I shouldn't be, ticketed. That I shouldn't be. I can go and find those people because they exist. But meanwhile, every other person that comes into that store who's a grandparent, a parent, an uncle, an aunt, a child of somebody's, they now are at risk because I had the right to be stupid.
Well, you have the right to be stupid, but then you have to look at, let me add to that scenario. Say you're in Walmart and you see somebody sneezing, touching everything, no mask on, not keeping distance, and then somebody else feels threatened, and then he goes into the hardware department, pick up a ball-peen hammer, and bash him in the head. Does he have that right?
Well, but okay, so you've taken it somewhere where, like, I'm not even trying.
That's what I'm saying.
No. But I'm not suggesting. Listen, so let us be clear. But stop, because I don't even want to. I'm not suggesting that somebody go and attack somebody who's doing something like that.
But that's where we're at. We're looking at people cussing out preachers in a Walmart line, because of distancing or because of a cough. We're at that level of fear and panic. So why would someone actually consider, going out, playing basketball, endangering other people's lives just for the simple fact of their own selfish pleasure and desires? When a little discipline gets us all through this together, and then you can play all you want. That's the whole thing. Impeding upon another person's, they go around with, my Bill of Rights. The Constitution says we hold these true self-evidence that all men are created equal and endowed to certain inalienable rights. That's life, liberty, and pursuit of happiness. In that, what does it mean that your pursuit of happiness means that you have to endanger someone else's life? That's what we're looking at. You don't care about your life, so therefore you're going to put a bullet in my head? That's what it's about. It's about being relatively social conscious, as well as loving yourself.
Yeah. So on to Will's conversation about the economy. This is the headline that just came in. It says a record 6.6 million Americans filed for unemployment last week. 6.6 million Americans. So now we talk about monolithic. Right? People are about to get real monolithic. Listen, you're about to get real monolithic in unison, right? Around not being able to pay your mortgage, not being able to pay your rent, not being able to pay your car note, not being able to pay your phone bill, not being able to pay your credit card bill, right?
Cable. Don't forget cable.
Oh yeah, man. Oh yeah, listen. Your cable, your PSE&G, y'all about to get real monolithic in this economic pain. But here's the thing that I look at, right? There were people who were already suffering the pain that you're getting ready to go through. And I'm going to go back to 52. Martin said there were 40 million people suffering that pain. And nobody cared. Up until 4 weeks ago, there were how many millions of people suffering that pain? And nobody cared. See, so this is what I'm saying to you, Vincent, about 9/11, right? That the needle didn't move, right? But now, and you see, because there were discussions then, and we talked about it off air. We've talked on this show about the fact that more than half of Americans, this is what we were saying about a month ago, more than half of Americans, if they were faced with a $400 cash emergency, they could be homeless. We had that conversation, right? Now, And during that, there was this noise on this other side saying, no. The reason those people are the way that they are is because they didn't work hard enough. They didn't work hard enough. See, they didn't subscribe to this rugged individualism, and they didn't pull themselves up by their bootstraps. That's why they are. See, you know why I'm where I am, and they're patting themselves on the chest and patting themselves on the back so hard that they got bruises now, saying, I'm where I am. I'm at the top of the mountain because I worked hard. Right? And I kept saying, no, we got to look at their past, because there were things that may have occurred, right, that led them to where they are. Irrespective of how hard they work. No. Couldn't see past you because you have these blinders on. But now there are circumstances that are out of your control that are now about to leave you in the same situation as the person you walked over so callously just 4 weeks ago.
Okay.
And now you're going to be on your porch demanding that you get saved financially.
There are two unique differences in your statement. Diane, you're in indemnification, right?
I'm sorry, in what?
Insurance.
Yes.
Okay. Explain.
We call it insurance.
Okay.
We identify you, but we call it insurance. But yeah, go ahead.
And explain to Eric about a accidental or unforeseen force of nature.
What do you mean, in regards to whether you get paid or not?
Correct.
Well, life insurance. People buy life insurance, for the expectation that, or not the expectation, they buy life insurance because they know they're going to die. So it's going to happen because the two things that three things in this world. You're going to stay who you are, you're going to live, and you're going to die. So you have for the death. At least you should be planning for the death, and that's how.
Good morning, everybody. How are y'all doing today?
Carl, I'm going to ask you to hold. Carl, I'm going to ask you to hold 1 second so Diane can finish her point. Go ahead, Diane.
Oh, okay.
Yeah. So I don't know. What are you trying to drive? What are you trying to get to, Vincent?
Okay. Yeah. See, Eric, you're talking about two different points. One is a foreseeable turn of events, leaving the person to homeless. And you like right now, or unemployment, like right now.
Right.
There's a virus in which shuts down everybody.
Right.
Okay. Now the driving force is the actual event or the virus.
1 second. No. We're gonna take this point by point. So we say the virus is the thing that's in front of us that is driving people to homelessness, right? So I'm gonna say, well, let's talk about wait. Let's talk about policies. Let's talk about redlining. Right, that drop rates, that drop property values, that led people to poverty. Come on, keep going.
Okay, so in this situation, it's that driving force being the unforeseen force of nature, which, they say, quote unquote, can't be controlled by no matter act, or the butterfly effect. If a butterfly flaps his wings in America, does China have a hurricane? But so what they're saying is that they needed to protect against that versus the other point that you were talking about, a person who has made choices either good or bad causing them to be homeless, and people looking down upon them.
I'm not talking about the choices that people make. I'm talking about the outside forces, not the choices that the person made. So I'll give you an example, Vincent. So in Newark, where they decided to build a 6-acre switching station, right across the street from some homes. If you were a homeowner, right, and you owned that home, at the point that they came in and built a 6-acre switching station, what would have happened? What happened to the value of your home?
Immediately dropped.
Wait a minute, I'm asking Vincent. What happened to the value of your home, Vincent?
It immediately dropped.
Did you have control over that, Vincent? No. Answer my question. Did you have control over that?
No, you did not.
And so my question is this. Those kinds of things, that kind of environmental racism occurs all the time. There are policies that are on the books now. And all I'm saying is this. When we look at those people who are homeless, those people who we say destitute, we can't just look at them and say they made bad choices.
That's not exactly.
And that's what I'm saying.
What I'm saying to you is this. That choice that you did not make in terms of your home being redlined, there are policies in place, because in doing developments, we have ran into that situation where we put up projects which affect everybody in the neighborhood. We had to pay them off and buy their home.
Right. Okay. Call a go.
Hello, good morning, everyone. I want to start off to say God bless everyone. May God keep us safe, and I love you all. And that's my last words to say to you. But I do want you to understand, it's Eric, I just heard a comment. I just got back on the show, so it's funny what you were saying, because I had a conversation with someone like that. There's two people right now that I know. One of them I really don't know. However, I met going along with the campaign and also coming to your show.
Mm-hmm.
And they really sick. However, I've been helping them and coaching them, and may God forgive me, and I told them this is at their own will and this is their own wish. Because I have lupus, I have that medicine. And I also, you got to take the old and put with the new. You understand? But let's keep most in point on this. Number one, I don't care what religion you are. I don't care how rich, poor, or your status. First and foremost, it is written in all the books, and I said this before, okay? There is no control. First is by the hands of God, because nothing on this earth is not going to happen without the permission of God. And he's trying to show us all something, which is compassion for one another. That's one. And if we don't get it, we're going to have a big problem. That's one. All the circumstances and what you're saying is of looking down on someone, you are absolutely right. That's why I take the risk, even when you see somebody homeless or somebody you might think they just want the money for drugs. I know what my intention is of giving it to them. Because it may not be drugs this morning. They might really be hungry. But God knows my intention. You understand? Yeah. And they say, thank you so much, miss. But you know what? Because the thing is, today it can be you and tomorrow it can be me. Amen. Everybody is being tested. Everybody is being tested, but I'm going to tell you something. So I made a comment to the person. I went through so much to get this person's phone number. People that I knew that had that phone number, they wouldn't give it to me, and they said some things about this person. So this person said to me yesterday, they said it was somebody else we found out was sick. They said, I know you might not be a good, the leadership. I said, no. I said, but guess what? I don't want nobody to die if I can help them the same way I'm helping you, and they're getting better. These two people, they're getting better each day by listening. Okay? And I'm going to tell you something. I said, but let me explain to you. Just like I said, do you know people didn't want me to help you? I said, one person, I said, do you know when I contacted you, see how late it was? I said, one person gave me your number. When I told them that person that gave me their number, I didn't know that they did this person wrong. You understand? But I told him, I said, see, circumstances that God put before us, it either change you, make you, break you, or you take this time to reflect. I said, because we make choices in life that's not the betterment. We do the betterment of ourselves and don't think about nobody else. Okay? I said, so God is testing you. So if they bring you through this, you need to do the right thing upon the people that you might have done wrong to. I said, but the person said, oh, wow, but who would want me dead? Who would want me dead? It's not the fact that they don't want you dead, that they want you dead. You're just not favorable, okay? You're not a favorable person. I said, but I still came for you, and I didn't leave your side since that day. I said, and I'm not until you get through the storm. So we need to remember that everything that's happening, the redlining, people losing their homes, the homelessness, it's all to put us in retrospective. That today is them, tomorrow can be us. He's making us humble ourselves. He's making us submit to him, because nothing is going to happen without you. I don't care how much help you get, but you need to be careful of how you treat people, how you do people, how you don't come. And you know what that person told me? All these people were sending them messages and said, if you need help or you need a favor, and they said, now one person told me no, that they could come get the medicine from you. Another person told me at a certain time and never showed up. But those was your friends. Those was your friends, and you don't even know me. And I said, you got food. I got stuff. They like, you're an angel. Thank me. Thank you. No, don't thank me. Thank God, because you asked him for something. He gave it to you, and he brought it to somebody you least suspected. So we need to be mindful. We can go through politics, and honestly speaking, as a person that worked for Roche and made medicine. I worked for Bristol Myers and made medicine. I studied medicine, and this virus right here, it mutates. You understand? And it mutates rapidly. And it all goes back into number one, how a lot of us was raised with self-claiming, taking care of yourself, taking care of your body, and not only that, having a compassion for somebody else. So we need to wake up. And we as a people need to really start looking towards each other. We fight among each other for the most stupidest things, but when we got to see RIPs and things, some things don't even matter no more. It don't matter. But honestly speaking, we as people have to do better, and God is showing us. He's putting his foot in our throat. And this is around the world. The world, people is man-made, yes, but nothing don't happen without the permission of God, whether it's good or bad, or the heavens, the earth, and the hellfire. So we need to pray more. We need to do more for each other. If you can't afford or you're scared, you can leave the stuff at the door. I walk with a can of Lysol. They said I'm a germaphobe. I don't understand it. We still got people out here shooting people. Why are you going out there shooting somebody? If you want to kill them and walk away, all you got to do is cough or shake their hand, and you won't get caught with the body, but you're still out here killing and robbing. Why? That's right. Why? You understand? So I thank you for that comment, because I just had that conversation with somebody, and I know they're sitting there reflecting on the things you might have done. Make up for the things you've done. You still got a chance today at this moment. Because at any second, it could be one of us.
Yeah.
I don't care how much I'm trying to protect me and my daughter with this, the spray. And I think if anything happened to me, it might be Lysol exposure and bleach. I don't know. But the ignorancy that we have, too, this is another thing. We have older people. We have older people walking around in the stores coughing and everything else. And talking about, I ain't worried about that. And the younger people talking about, they still sharing blunts. They out here drinking, smoking, partying, and everything else, passing it along. And I had to stop a group. I said, you might be a carrier and you don't have symptoms. What about your mother, your grandmother, and your kids? Right. You know what, miss? You are right. And they left. So we got to be a little more resilient. We got to take the time to share that message. I love you all, and thank you so much, and may God have mercy upon us all. Amen. Thank you.
Amen.
So listen, we're going to play the next clip. This is news from NPR. We'll be right back.
Live from NPR News in Washington, I'm Corva Coleman. The number of worldwide infections from the coronavirus is inching toward 1 million people. Researchers from Johns Hopkins University say more than 48,000 people around the world have perished. In the U.S., the death toll has reached more than 5,100 people. NPR's Allison Aubrey says the Centers for Disease Control and Prevention is looking closely at COVID-19 patients who have died.
So far, the CDC has found that 78% of people hospitalized in the ICU with COVID in the U.S. had at least one chronic or underlying condition. Some of these are very common. A third had diabetes, 30% had heart disease, 21% had chronic lung disease, which includes asthma and COPD. So people with these conditions are most at risk, but we should point out this is unpredictable. The CDC has also found in an early snapshot that 20% of patients hospitalized were under the age of 44.
NPR's Allison Aubrey reporting. Job losses related to the pandemic are continuing to grow. NPR's Scott Horsley reports the Labor Department will issue a new tally of unemployment claims this morning.
Coronavirus layoffs are shattering all previous records in both size and speed. A week ago, we learned more than 3.25 million people had filed for unemployment since the beginning of widespread public health measures. This week, we could exceed that tally with another 4 or 5 million people out of work. Businesses across the country have been closing their doors in an effort to slow the spread of the virus. Forecasters say the unemployment rate is likely to soar from just 3.5% in February to 12 or even 15% before the pandemic's under control. Most of that spike will not show up in tomorrow's monthly jobs report, though. It's based on surveys taken before the big coronavirus crackdown. Scott Horsley, NPR News,
Washington.
The Federal Bureau of Prisons says 3 inmates have died of COVID-19. All the deaths have occurred at a facility in Louisiana. The Federal Bureau of Prisons says nearly 20 other federal inmates have been sickened by the coronavirus. The agency has ordered that all 146,000 prisoners be kept in their cells for 14 days to help slow the spread of the illness. The patriarch of the musical Marsalis family has died of COVID-19. The family of jazz pianist and educator Ellis Marsalis says he has died at the age of 85. The accomplished musician recorded 15 albums and played weekly at a small club in New Orleans. Ellis Marsalis had many accomplished students such as Terrence Blanchard and Harry Connick Jr. They also included his children, Branford, Delfeo, Jason, and Winton. This is NPR.
Hey guys, welcome back. So, my hope is that the Marsalis family is comforted in this time. I actually met Winton a couple of times. I got a funny story that I'll tell offline about him. I won't say it here. But I saw in the thread, I don't know if you guys want to comment on some of the things, but I did see somebody say, can we move on? So what I would say is, go ahead and move on. like
I was going to tell you to stay out that feed, but I knew it was coming.
Right. You move on. Go. See, you're one of the ones that I want to kick off my ankle because you're holding me down. Move on. Move on. Get off. Get off. Get off. I may finish this and block you, and then I guess you could go see me on YouTube. But get off. You go. Goodbye.
There's a couple of people in the feed and they're saying stuff, and somebody else responded to them and said, yeah, I don't understand why they're here. They said, well, they're instigators. I said, well, haters can't help not watching, because if they don't watch, they have nothing to hate on. Right. They just left to their own devices in their own mind. So they can't get out of their own self.
Because here's the issue. Where Will called and talked about the economy. All of this, their stupidity, their arrogance, their selfishness. I'm talking about all those people who are continuing to help spread this thing. They are contributing directly to your inability to get back to work. See, and you're too dumb to understand that connectivity. See, the longer we go from, changing the curve, right, and slowing down and stopping the spread, the longer we go, the more we have to be isolated, right? It's kind of like a kid. Remember, Diane, you have children. Vincent, you have children. Remember, you tell your child when you were when they were younger, the longer you keep crying, the longer you're going to sit there in that corner. Or the longer you keep doing something, the longer you're going to sit there in there. And they couldn't connect it, right? They didn't realize, okay, if I stop this behavior, things will get better for me. And so things are not getting better, right? Because people won't stop their behavior. But you want to complain about the condition. The condition will change once you stop the behavior. Do you understand that? So the fact that 6.6 million people filed for unemployment, and the fact that they now had to extend this whole thing, has to do with what we talked about earlier. That like in Taiwan, where they shut it down, they changed their behavior, so the circumstances changed, they're going to be able to go and take care of things that they take care of. We've decided that we want to be that kid in the corner throwing a goddamn tantrum. Right? But then we got the guy in the feed that says, move on. See, this is what I'm saying. See, people who are ignorant and uninspired to develop, move. Get out of my way. You are a danger, a clear and present danger to us all.
Yes.
Yes.
I agree. Because it's once again, they're exhibiting that selfish, childish behavior called "it's all about me." They are in denial of what's really happening, because realizing what's truly happening and how dangerous they are. and how dangerous they are to themselves and others is not in their plan. So I'm going to deny the simple fact that there is a disease out there. I'm going to deny the simple fact that it's spreading faster than the flu. I'm going to deny the simple fact that people can die around me because I want to play basketball.
Hey, Diana, can I read what I was going to post on Facebook, but I didn't post, but I put it in I sent it to myself. Can I read it or should I not?
Oh, gosh. No, please don't.
Okay, I won't. It's going to come out one day.
Don't post it. No, don't post it either.
Okay, but okay, I won't.
Oh, by the way, I sent you a feed from the World News Today and the USA Today.
Okay.
About the president downsizing the pandemic.
Oh no! Don't. I understand that he downsized it. That he downplayed it. I understand that, right? I understand that. He said it was kind of like the flu, or not quite like the flu. That only 15 people died, as opposed to at that point only 15 people had died compared to the almost 60,000 people that die a year from the flu. So what's the big damn deal? We were gonna get right back to work. We're gonna do all those things, right? I understand all of that.
Okay.
Right. The article that I put out was just about. I didn't put the article out. The article I shared was just about so that we can wrap our heads around and get on the same page when we're having a conversation around the department that was supposed to protect us and identify these pandemics, right? That is the discussion that he disbanded that entire department. The article from Reuters that I put out suggests something different. So I'm saying that I can't do it right now, but I'll go into the feed, and if we want to have a discussion about it, and then we can unpack it tomorrow a little bit, I'm happy to do that.
But here's another point in which he did, and everybody was talking with him about making changes. The part about Obamacare and being able and using Medicare for those uninsured or underinsured to pay for their hospital expenses and seeing the doctor about this virus. They sidestepped that entire issue and did not discuss it. So now we have a situation where, of course, he downsized the protection and safety net or insurance against it, but he also will not reinstate the part that will allow people to get medical attention for it.
Right. So can I say, and I posted this too. We have to stop talking about our government in the abstract, right? Whether you're a conspiracy theorist or not, right? The conversation that I see abounding on social media is, the government, not our government. They say the government, right? So they detach themselves from responsibility, right? The government is conspiring against us. The government is doing this. The government is doing that. And I'm saying, okay, well, what are you doing to change the government, right? If you recognize these things are happening, what are you actively doing other than floating out your conspiracy theories? What are you doing to remove the conspirators? And if you're not doing anything to remove the conspirators, then you're just a waste of time.
Right. You're part of the problem.
You're part of the problem. So let's say I agree with you. Then let's get rid of them all. But what we know is this, that after this election, after the election occurs, right, whenever that's going to be, because they're talking about postponing primary after primary, but we're going to see the majority of the people who are there right now stay in their seats. The majority of them are going to win re-election. And so if we believe collectively...
You rolled your eyes about that one.
Huh?
I saw Diane roll her eyes about that one.
Oh, you don't believe that's going to happen?
I think she's shuddering at thought of some of the people staying in office.
They're going to stay.
No, what I'm shuddering at is the fact that people could be so complacent with what's going on and upset and on Facebook and all the social media pages and talking about it with their friends and family about the situation we're living in now, and then walk out there or mail a ballot in to elect the same exact person that's in there now. That's up for them. I just can't understand and or see, or I'm in disbelief that people would be so stupid to do that.
Well, but you know what though? But here's the deal. Here is the deal, Diane. And like I'm like laughing at this, not not laughing, right? But chuckling inside. No, I'm in like a full out laughter, like knee slap laughter inside. I'm not just chuckling. Right? So here are these people. So on one hand, they're complaining about the conspiracy theories. Over here, they got suckered into this idea of not helping people because people should be picking themselves up by their bootstraps, right? They are callous enough to walk over homeless people, our residents without addresses, right? They lack compassion enough to provide a meal to somebody who is food insecure. But these same people who are wrapped up in all of that stuff, all that crazy nonsense, those people, I'm telling you, they're Googling and they're looking to see when their check is going to come. They're
even posting. They're posting and saying it's going to be in 3 weeks.
That's right. Those same people. Because, man, and we come in full circle again, because in the end, these United States, we're not united. We're not. We're not united at all.
No.
Not at all. It's what can I get? That's it.
Yeah.
What can I get? And our government, see, because I take responsibility. Our government is the way that it is because they know we're not united. Right? And so what they work to do is not to unite us. So this is again where I say we're not monolithic. They have no intent on uniting us. They want to keep us in our respective corners.
Right, because you're easier to control.
That's absolutely right.
It's easier to control you because not only do I have you divided, but now I get you to fight against each other.
But you know who is united?
Now that you are divided, I'm going to give this person something to make them feel special. So now everybody attacks that person, and then you feed the next one, and they attack that one.
Yeah.
So as long as I can keep you divided, I can control you. Which means that now that I'm controlling you, you depend upon me to give you whatever crumbs. This government cheese. Sorry, my government cheese at $1,200.
Hey, listen, don't. That government cheese got my family through it. It made the best macaroni and cheese and the best grilled cheese sandwiches ever.
Yes, that government cheese may have gotten your family through. Now, when you look at the inside of that, in terms of that government cheese, you paid for it 20 times over in your tax dollars.
Sure.
So, but it's okay, because I got the cheese.
But you know who is united? We're not united. But all those people down in Washington, they're united. Even though they look divided, they're united. And the reason you know they're united is because they stay a part of that elite club. So at all costs, their job is to stay a part of the elite club. They were united. Right. Look, they were united against AOC, Democrats and Republicans, right? Because they said she's trying to break up our club. They were united against Ilhan Omar. Why? Because she's trying to break up their club. They're united against Rashida Tlaib, both Democrats and Republicans. Why? Because they're all trying to break up that club. So I'm saying that club is united. We're divided. So anyway.
And here's another interesting fact. If you look at it, they're united so that club can stay intact. And they're united in the simple fact that they just brought your vote for $1,200.
Yeah. Well, they're talking about so there's a conversation now.
They brought your vote for $1,200 that you're paying almost $3 trillion.
Yeah, there's a conversation now that's in the House where they realize they realize that $1,200 is not going to be. I mean, it's already spent. I mean, I want you to understand it's already spent. So for those people who couldn't pay their rent yesterday, right? They told their landlord what? Oh, my check is in the mail. But that's what they did.
You know what they've been saying, Eric? They've been saying on Facebook, and I've been seeing it, people were talking about, well, I talked to my landlord, and my landlord didn't hear anything about that I didn't have to pay my rent this month. The governor said that. Governor Murphy said, what? That is not what he said.
That's not what the governor said at all.
Right.
They hear what they hear.
Yeah.
But they forget the fact that Donald Trump got on the air and said, people are going to die who have never died before.
Well, look, he's got gaffes. He said it, but look, I'm not going to dwell on that one. There's an article that just came out in the AP. It says more evidence indicates healthy people can spread the coronavirus. Right? It says scientists offered more evidence Wednesday, it was yesterday, that the coronavirus is spreading by seemingly healthy people who show no clear symptoms, and the federal government issued new guidance, warnings that anybody exposed to the right. But we talked about this, and I think I talked about this too, and it's worth mentioning again, because I tried to get clarification on it, and I was correcting what I said yesterday. There are police officers in East Orange Police Department right now. I tried to get some of them to call in, right? They called me and expressed concern, but I said that they had to call in. They didn't want to call in, and so I didn't talk about it yesterday in great detail, but I'm going to talk about it now. Who are concerned because there are people there who are exhibiting some signs, and those people have not been removed off the force for whatever reason, and self-quarantined or told to self-quarantine. There are they are operating without the proper equipment, gloves, masks, those kinds of things. I was also told that some of the officers have complained up the chain about the fact that they don't have wipes and things like that to wipe things down. And there's no real focus on that. And I'd like, somebody higher up in East Orange to tell me that that's not true. I'd like the mayor, to call in and say that he's enforcing that and that he's heard about it, because I know he has, because people told me to call him, and those people told me I trust. But here's the thing that gets me, and I'm going to say it to you guys again. I think that we're doing it wrong. Here is how we're doing it now. At least in the Newark Police Department. If an officer displays some symptoms, right? What they do is tell the officer, you got to be out for 14 days. So let's, I'm going to take this slow. So let's say I'm the officer, Officer Dawson. I go in there and I'm sneezing, I'm blowing my nose, And so they say, Officer Dawson, you have to go home for 14 days. But let's say Officer Clements and Officer Squire, that I had lunch with them earlier that day before they told me that I needed to self-quarantine for 14 days. Well, they don't tell Diane and Vincent that I had to self-quarantine for 14 days. They just tell me to go monitor myself. Now, day 1, day 2, day 3, day 4, all those days go by as I'm monitoring to see if I'm developing any additional symptoms that might lead me now to go and get tested, because I'm not getting tested yet. All I'm doing is self-monitoring and distancing myself from everybody for 14 days. Let's say on day 10, more symptoms present themselves, which now leads me to call my doctor and go get tested. When they test me, so now we're day 10, and I am diagnosed with COVID-19, it is then that I call the police department and say to them, I've been diagnosed with COVID-19.
I'm test positive.
I tested positive. They then will ask who came in contact with me.
Everybody.
But in that period of time, but forget about me, because I self-quarantined after the first day. But you, Diane, and you, Vincent, who had lunch with me that day, you all have gone and touched and talked to how many people?
Oh, there's a 20-person multiplier.
There we go. And so now the people you talk to have talked to people, and it's multiplying out like that. But now on the 10th day now, they come to you, Diane, and you, Vincent, and they say what? You have to self-quarantine for 14 days because you were in contact with Eric. They don't then do an inventory of all of the multipliers that you talk to. Right. They start that same dumb process all over again. Meanwhile, it could be transferring. I'm suggesting, listen, this is what I'm suggesting. Know why let me finish, let me give my suggestion. And then you can have the floor. Here's my suggestion. If you take an officer and you identify that officer may be sick, that should be enough for you to think that he is or she is sick. And so when you remove them and tell them to self-quarantine, at the same time, you should be inventorying the people who they've been in touch with. And you should notify those people, too, that, hey, listen, we've self-quarantined this person. And even if you're not going to self-quarantine those other people because they're not exhibiting symptoms, according to this article, they could be a carrier, right? So at the very least, you should limit their exposure to people, give them different kinds of assignments, make sure that they're wearing face masks, right? And make sure that they're wearing gloves. And then, yes, you should be spraying and wiping down everything.
But, Eric, with that, I think the quarantine that we're under right now is self-contained quarantine. I think that it's actually beneficial because, like you just tracked that, I was talking to someone yesterday, and I was telling them, remember, I was in Spain. Me and my daughter were in Spain in February. And this has actually started in November. So the government has known since November is when they kind of tracked and still are trying to find who patient zero really is in Washington. So just think of this. I was in Spain with my daughter. We went to restaurants. We were out amongst people. We went to the malls. We went to various different places. We went to museums that we interacted with. Leave Spain, we were at the airport. We went through customs several times. And customs, everybody is like shoulder to shoulder in there because they're trying to get through to get out. Come into the Newark airport. Come through customs again through the Newark airport. Within that same week, I told you my friend passed away. I had to fly down to North Carolina. Flew down to North Carolina with a plane full of people. Went through the airport again. Went through the airport in North Carolina. Got a rent-a-car. Talked to the people there. Interacted with the people there. Exchanged keys and all of that. Went to a funeral. Interacted with a bunch of other family and friends and stuff. Left there. Went to another location in North Carolina. Saw some other people 2 hours away down in Charlotte. Came back to Greensboro to get on the plane. Got back on, came back to Greensboro because by then it was starting to pick up. Coronavirus was starting to pick up. So my husband said, no, don't get on the plane, drive back. Rented a car, drove back from North Carolina. But in between there, stopped at various rest stops on the way back from North Carolina to New Jersey. So how many people have I been in contact with just since February?
Yes.
They should be calling you Typhoid Mary. You have wiped out 2 civilizations.
Yeah. From New Jersey all the way down to North Carolina.
Yeah.
And coming back from Spain, I had a layover going into Miami.
Yeah.
So I interacted with people at the restaurants and the airport there. And then coming back, I had a layover in Chicago.
Yeah.
And interacted with more people.
Yeah.
They should have a disclaimer on your forehead.
Yeah.
They should put a disclaimer on your forehead. Warning, this woman will cause you to die if you stay away at all
listen, guys,
costs.
I want to thank you all. Diane, thanks for letting me know that we had 8 minutes left. We went 9 minutes. So, but listen, it's going to get worse before it gets better.
Right.
It's going to get worse. And I'll keep praying. I'll keep hoping. I'll keep speaking out about it. But we have to change it. Things have to improve.
By the way, I'm sorry.
No, go ahead.
We were talking about board games. There's a card game called Cards Against Humanity. It is a scream. I mean, it's an adult game, so if you're staying at home and you're wondering what to do, buy that on Amazon. It is great to do.
Gotcha. What's the name of it again?
Cards Against Humanity.
Cards Against Humanity. Okay.
All right, guys. Here's the last piece of news that I had from this morning. Oh, and CNN. We're gonna play that, and then we will be done. I want to thank you guys for tuning in.
Thanks for having me.
Hey, you're more than welcome. Diane, you stay safe. Vincent,
Stop contaminating people, right?
Yeah, you stay safe and you stay home.
Hello, I'm Amara Walker, and this is your CNN News Briefing. Florida Governor Ron DeSantis announcing a stay-at-home order for his state. DeSantis signing an executive order directing all Floridians to limit actions outside of their homes. The order will go into effect on Friday. DeSantis has been widely criticized for not issuing such an order sooner. Florida has been among the states with the highest number of confirmed coronavirus cases. Russian President Vladimir Putin increasing punishments for quarantine violations leading to the spread of coronavirus. According to a document posted on an official government website Wednesday, Putin signed a law increasing jail time and fines for people who violate quarantine rules, including up to 7 years in jail if the action causes the deaths of 2 or more people. In a separate law Putin signed, Russians now also face up to 5 years in prison for spreading intentionally false information about coronavirus. New York Governor Andrew Cuomo announcing all New York City playgrounds will close. Cuomo blamed a lack of compliance by younger people for the move, all of what he described as a broader effort to reduce population density in the city. For the first time since World War II, this year's Wimbledon Tennis Championships has been cancelled. Organizers of the UK tournament decided to scrap the event due to the ongoing coronavirus pandemic. The grass court Grand Slam was due to begin on June 29. And a programming reminder, CNN's chief medical correspondent Dr. Sanjay Gupta is hosting a podcast on the coronavirus titled Corona